Hi, it's Dr. Tsay. We're going to be doing a case of Renuva on this patient who has had a history of liposuction and subsequently developed some irregularities, some divots, some shadowing that she can see. And Renuva is the latest filler in the market. It's a fat filler that is donated fat tissue. And so we're going to be using it to fill in the irregularities, and it usually takes about 2, maybe a third session, and it is a permanent result. And it can also be used in other areas such as breast divots, dimpling, irregularities. It can be used in the face and also can be used for butt augmentation.